describe the Pediatric AIDS Clinical Trials Group and its significance.
Sure. The PACTG stands for the Pediatric AIDS Clinical Trials Group, and they were, in 2003, when the FXB Center first started working with them, they were a national, federally funded research organization with multiple sites across the United States that had done clinical trials related to treating infants and children with HIV infection, and also treating pregnant women in an effort to prevent mother-to-child transmission of HIV infection. So this is the group that first conducted trials in children with antiretrovirals and first conducted trials in pregnant women with antiretrovirals to prevent transmission. So they're a very significant group. And in 2003, they elected to become an international research group, largely because the epidemic of HIV in infants and children was significantly reduced in the United States as a result of the work of the PACTG. Because of the clinical trials they had done, we significantly reduced mother-to-child transmission of HIV. There were many fewer infants and children infected in the United States, but there was a huge global epidemic. So in 2003, they became the International Maternal Pediatric and Adolescent Clinical Trials Group. And they were looking for an organization to help support training and capacity development in the international settings in developing countries where clinical trials were going to be conducted. And they specifically asked FXB to compete for the RFA that they put out for training and capacity development for this project. And Mary Boland and I wrote a proposal to what had become the Impaact network, and we were awarded that contract. So as a result, I left my old job and came to FXB Center to be the manager of the Impaact Training and Capacity Development Program. And over the course of the next 4 or 5 years, we went to about 17 different sites in 7 countries, in South Africa, Uganda, Malawi, Thailand, Botswana, Tanzania. And all of those sites we helped conduct training so that they were better prepared to conduct clinical trials in their countries to help stem the tide of the pediatric and perinatal epidemic in those countries. So I think it was very significant.